What do you think are the main challenges faced by communities across Scotland, and have these changed in the years since the Act was passed in 2015? For example, we talk about the COVID pandemic, but also looking ahead, what role could CPPs have in supporting communities during the cost of living crisis?
I think the challenges faced by communities and therefore by community planning partnerships over the last 7 or 8 years since the passing of the Act, and indeed before that, is the rising pattern of poverty and inequality in Scotland and indeed across the UK. And I think the significant challenge there is that's very oftentimes out with the control of community planning partnerships to really have a significant impact on some of those patterns. So we've seen over the period, even since 2015, we've seen downward pressure on the incomes of those who are already on the lowest incomes through a whole series of changes and cuts to social security. So that context, I think, has made some of the long-term changes that community planning partnerships want to make all the more difficult to achieve. I think also going into the pandemic, that clearly exacerbated many of the problems that were already existing in many communities, and I know that the committee and parliamentarians will have heard a great deal over the last several years about exactly what those problems were. And I think Dave was starting to talk about that isolation that took place. Members of the Poverty Alliance talked about the so-called supercharging of existing inequalities during the pandemic. So these have all made some of the challenges that the structures that are in place to address poverty and inequality.
We heard from the last panel about the lack of data, but we do have some data, and there is data collected by improvement services show massive inequalities between communities which are in the same local authority area, and for example in Glasgow between Springburn and Maryhill and Kelvinside and Jordanhill.
I think the question around data and whether we're having an impact on inequalities, they're related but almost separate questions. So I think there's, over the period that I've observed community planning, I've seen a better use of data, and I've seen data being used more creatively. I've seen the various different actors at local level very focused on how they use data and trying to understand the data that's available to them. So, for instance, in Inverclyde, I know that there's been a great deal of work going on there with the local authority and with Public Health Scotland supporting and with the Improvement Service supporting to better understand the data that's available and how that can be applied. This is in the context of local child poverty action reports, but I think the example is applicable to wider community planning. So I think there's more and better data around, and I think what Dave was saying about other forms of data, and particularly qualitative data being brought in, I think is really important. The question, though, about are the long-term outcomes that are set in LOIPs and elsewhere in other versions of plans, are inequalities reducing? Again, I think we need to tease out what is within the gift of the various local community planning partners to affect those long-term outcomes. They may well set them, but what's within their gift to actually achieve them. So we know that, for instance, health inequalities, very worryingly, are starting to widen again in Scotland. And I think that the community planning partners can make a significant contribution to reducing those inequalities. But there are patterns taking place, there are processes rather taking place at Scottish and UK level that are driving some of those widening inequalities. And I think we need to get that balance right between understanding the specific role of community planning partners in reducing those inequalities and the contribution.
And I wanted to ask the panel with regards to your experience of partnership working, where you've seen more collaboration take place, and specifically any shift towards preventative action, and you've touched upon a couple of cases like the Edinburgh and Midlothian ones, but I wanted to see if there's any, especially with regards to resources, if you could present any examples.
Thank you for the question, and I think it's one of these issues where I feel as though we're in a position to give examples of good practice, because that's where we're drawn to. You know, when we're drawn into those conversations, it's generally through our local authority contacts primarily, who are wanting to improve practice. So another good example would be Argyll and Bute Council, where we've done a good deal of work with Argyll and Bute to work with a whole range of community planning partners and service delivery organisations to improve their understanding of poverty and how it impacts, particularly in the rural context. So I think you start to see where there's a willingness. That's in part driven by the plans that are put in place. You know, the plans, if plans are put in place to see more progress in addressing poverty, and one of the means to do that is to have the different partners working together more closely, then that drives that collaboration. So in that way, I think the community planning process has been useful in helping to foster that greater collaborative approach. It's still quite difficult, though. I think it's the Argyll and Bute work. I can see where there has been really important changes in the way that they go about developing plans and putting them in place. Again, focused mostly on the child poverty theme. But I know from engagements with other third sector organisations in Argyll and Bute that they perhaps don't experience that same sense of culture change and involvement. So again, it's that same story of how we spread that engagement and those lessons around collaboration out, even within one community planning partnership.
The Community Empowerment Act was supposed to strengthen people's voices, you know, give them a say in the services that they rely on. And so I wanted to ask particularly about disadvantaged and marginalised communities as to whether that's actually been realised at all as a result of the Community Empowerment Act, and what more we should be asking government to do to actually realise that, to give those marginalised and disadvantaged communities a voice in the services that they rely on. Perhaps come to Peter first, then Ruth.
Thank you. So I think in terms of community empowerment, community involvement, participation, whatever phrase you want to use for it, we are very much still on a journey. You know, the 2003 Act talked about making sure that people in communities are genuinely engaged in decisions that affect their lives. I think we could say that across Scotland there are large parts of Scottish society, large parts of the population, where they would not feel as though they are actively engaged in the decisions that affect their lives. And I think things have changed and things have improved, and particularly since the Act in 2015, things have definitely changed. But I think there's an awful lot of scope for further improvement. I guess what we also see, and again I'm going to use the lens of the local child poverty action reports, which are obviously a requirement under the Child Poverty Act in 2017, but we've seen some really quite creative approaches to involving people with direct experience of poverty and trying to shape those approaches to addressing child poverty at local level. We've seen a whole range, and I can talk at length about the different examples where local authorities, community planning partnerships have actively sought ways to engage with people. But those examples of good practice, I would say, are still in the minority. I don't feel as though across community planning partnerships in their totality, I don't think we've embraced participation in the way that I guess we'd hoped we would have done through the Act.